Local Women Magazine presents Local Women Podcast, the show for things that matter. The Aesthetic Podcast from Local Women Magazine. This podcast is brought to you by BTL Aesthetics Ireland, supporting clinics with aesthetic solutions.
Hi, I'm Emma Heaney from Elite Aesthetics in Derry, and I'm the Local Women podcast host for the Aesthetic Podcast. And today I'm joined by Tara from AlterEgo Aesthetics in Belfast. And we're going to focus on New Year, New You. And I know in my clinic what the treatments are in January. It's real focus on weight loss, body contouring. But Tara, what about yourself?
Yeah, we would see a lot of people coming in wanting a fresh start for the new year and a kickstart for their weight loss. We would also see people wanting a bit of a freshen up, maybe who before Christmas have been focusing on their kids and who are wanting a wee bit off looking after themselves.
Yeah, and Profilo's a big one for me for the refreshing in January as well. But talking about weight loss, are you happy to share your journey with your weight loss pen? And we also know you had weight loss surgery as well.
Yeah, I am indeed. So basically, I have always been a big girl. Going into first year in school, I was a size 14, so at 11 years old, that's big, and I kind of was my whole teenage life. After having kids, that didn't stop, and about maybe 4 years ago, I started on the weight loss pens at the time, which was Ozempic. I had a great result from those. I don't know how much you know about the GLP-1s, but basically they act on the hormones in the body that are responsible for hunger and for making you feel full. So ghrelin, the hunger hormone, is reduced, whereas the leptin, which is the hormone for feeling fullness, is increased. And I felt great on them, and it was easier for me to be able to manage my weight, and I did manage to lose 3 stone in about 6 months.
Which is really safe weight loss. So Ozempic is actually the generic name for it. The drug is actually semaglutide. It was then changed to what's called Wegovy, which is now the gold standard for choosing of weight loss pens. When you talk about you've had a really positive result, we also have to remember as well, there is side effects. The most common being nausea, vomiting, diarrhea, constipation, heartburn and sulfur burps. But it's not an easy, quick fix, and it has to be done really safely. It makes me feel really reassured the length of time it took you actually to lose the weight. They usually say about 21% when you're using the Wegovy. I mean, there's different pens on the market as well, like Monjaro came out after that. And I know you then progressed on to have surgery. I think the most important thing is when you're on a weight loss program, it's making sure that you're supported. It's not just an injection once a week. You have to make sure you've got good nutritional advice. You've got to have a psychological support as well. I'm sure you would agree.
Absolutely. The consultation for me with my patients, so we do offer a weight loss clinic in our clinic, and we are members of the National Medical Weight Loss Programme, which was extensive training. You know, it wasn't just this is what you do, go and do it. It took me, I think, a week to complete the training. I was then assessed on that. And we do a real comprehensive in-clinic consultation. So we're not just looking at the BMI of patients, we're also looking at other factors, waist circumference, what their habits are, because at the end of the day, weight loss injections are a tool. They aren't a quick fix, or they aren't there to solve a problem. We have to make sure that you're mentally ready and that you're physically ready to make those changes to your diet and to your lifestyle. With regards to the consultation process and having that support, ongoing support, is really important. So we can look at titrating the doses. If you do have any side effects, that we should be able to reduce or maintain doses and give you advice or prescription medication to help with that. I was quite slow in titrating my doses. And I worked alongside the person who prescribed them for me to make sure that it was the best thing to maintain and have effective weight loss, basically. Yeah.
I've noticed as well that, I mean, there's a strict criteria. The NICE guidelines say you have to have a BMI of 30 and above, or 27 and above with a predisposing health condition. I think it's really crucial. It's not for somebody that just wants to drop a few pounds. This is a medical program. This is obesity. Obesity is a medical condition. I think it's really important to sort of hammer that message home. It's not a quick fix to get into a dress for a wedding.
No, and it's a prescription-only medication. Yet all over social media, we are seeing it being marketed as a skinny jab. £79 and this will get you this in 4 weeks. And it's crazy. There's no consultation process. And you could have people who have underlying conditions who are not suitable for the drug because essentially it's a drug.
Yes.
And certain conditions should not have it. If you have had pancreatitis before, you shouldn't have it. If there's thyroid cancer in your family, that's another indicator that you maybe shouldn't have it. So there's lots that goes into the consultation process. And I have had horror stories from patients of my own who have had them elsewhere and been handed a vial to self-administer. Whenever pens that are purchased through a pharmacy and are CE marked and are the proper drug, they only come in pens, and they are prescription only medication. They are prescribed to the patient.
I think, it's probably important to explain it's a preloaded pen.
Yep, sorry, a preloaded pen. That would be the best way to say it.
And as well, I mean, I wrote an article a couple of months ago about the dangers of the black market of the pens. And I think the public need to know about them. The World Health Organization also, they issued in June their concerns with regards to the side effects of these so-called black market pens as well. So I think due diligence, do your research. There's lots of clinics that are part of the National Medical Weight Loss Programme, and that's the people, if somebody asks me, that's where I would signpost you.
You can go onto their website and type in your postcode and they will give you the location of clinics in and around you who have done that extensive training, who are medical professionals and are able to prescribe it for you safely after consultation.
That's really good advice. Also as well, I'm not sure about you, but I see they call it the Ozempic face. It's all over social media at the moment.
Yeah.
I mean, I think it's probably because of on the red carpet at all the events, you're seeing all the stars super, super slim down. The Ozempic face isn't a good look.
No.
You do a lot of facial rejuvenation with fillers, so maybe you can sort of let us know what way would you treat the Ozempic face?
Yeah, so basically when we lose a lot of weight, the fat pads in the face kind of disappear and we can also get more skin laxity. So it is a really different approach for different people. Some people will just need a bit of filler to replace what they've lost. Other people are going to need the likes of Sculptra or skin boosters to improve the integrity of the skin. One of the most important things that comes up for patients is, when should I start doing these? When should I start looking after my skin as I'm losing weight? And basically it's a process. So I would say to come in for a consultation, and maybe at that point you aren't going to need anything, but we could say, right, in a few months' time you might need a wee bit of mid-cheek rejuvenation and kind of go on the journey alongside one another. A lot of my patients would start off with, maybe it usually is the mid-face, the runner's face, the kind of way needs it first. And then I do find in and around the jawline and periauricularly, sometimes they need Sculptra in that area and the temples, just to help, I hate using the word lift, but just to help support and rejuvenate that area and make the skin and the face look less drawn and less gaunt.
When you say periauricular, she means here.
Yeah, sorry. Here.
And for body-wise, what's your advice for body-wise treatments and things like that?
So body-wise is probably one of the things that people struggle with the most. Your body changes dramatically when you've had rapid weight loss, and I know that from experience. There are lots of machines on the market. Actually, one of the things I constantly would say to people is supplementation. What you're putting into your body is so important. So the likes of collagen supplements, making sure you're getting your vitamins.
Your protein.
Your protein, absolutely. Your topical, making sure your skin's hydrated and getting good ingredients into the skin like hyaluronic acid and things as well can also help. But when it comes to the machines, now you are the queen of machines. I'm going to pass over to you because I don't know too much about them. Years ago, I had a wee bit of cavitation done, and that was a long, long time ago. And I know the machines have progressed so much from then.
They have. I mean, you sort of comparing between cryolipolysis and lipolysis and laser lipolysis. There's so many out there, and really it depends on the patient. What might be good for me may not be suitable for yourself. So you've got like the likes of Sculpt out there, which is not only a muscle stimulation, which is going to give you muscle, but also the Neo is fantastic, but also tightens the skin as well. Yeah. And it also kind of targets certain pockets of fat that you just can't get to. In the gym you can do as many press-ups as you like, but you will not beat the Sculpt Neo for that. Then you've got like the likes of radio frequencies with ultrasound. You've got the likes of the Emerald lasers and the Vanquish Me. So there's so many out there. So my advice would be have a consultation. Yeah. Let your practitioner assess your body mass and see which is the best treatment for you. And as well, it's not a one treatment. You're going to need maybe 6, 8. It really does depend. And because it's not surgery, you have to maintain. Everything needs maintenance. But when we talk about surgery, are you happy to share what surgery you've had?
Yes, so this is kind of strange because I've never spoken about it in this kind of capacity before. Anybody who's commented on my weight loss, I have told them straight away I'm straight out with it. But I had a gastric sleeve in January of last year, so almost a year post-op.
Can I ask why you went for the gastric sleeve, even though you had done the pens and lost the 3 stone?
Yeah. So I had done the pens, lost 3 stone. And at this point, this was when there was that kind of strange era between Ozempic and Wegovy. So basically, Ozempic was used off license for weight loss. Then whenever it was licensed for weight loss, because it's the same drug, it's semaglutide, Wegovy took over as the licensed drug.
But it took its time to come onto the market.
There was kind of a time where there was nothing. We couldn't get Ozempic, we couldn't get the Wegovy. And so I had a prolactinoma, which is basically a growth in your pituitary gland. It affects your estrogen, testosterone, and all of your hormones. And the weight gain for me was crazy. I developed a top belly, as I called it, which I had never had before. I'd always been quite hippie, big bum, not much of a tummy, but now I had it everywhere. I went to the gym 3 to 5 times a week and couldn't shift this weight at all. Then the Wegovy kind of way started coming into effect, but it was always out of stock. We couldn't get that again. Right. And I was getting so depressed, I wasn't myself. And this is something I had researched for a family member 3 years ago. They had had the surgery successfully. And I was getting to the point, I was pushing a size 20. I was lost all my confidence. It was holding me back in my job. I couldn't progress because I couldn't speak to people because I felt so self-conscious. Couldn't take photographs unless they were from here up and at a specific angle. So I was just like, do you know what? I've spent 40 years of my life battling my weight and I can't do this for another 40. I needed to do something. So I decided then to go ahead and have the gastric sleeve.
Mm-hmm. And can I ask where you had the gastric sleeve?
So I did have it done in Turkey, but the surgeon that I had researched outside of their website. You know, he had written papers, was peer reviewed. He was the professor of 2 universities. You know, I really got to know him as a person. I asked so many questions. The reps who were involved probably weren't the best. They weren't medical, and I kind of bypassed them and spoke to the surgeons and spoke to the medical team and got any kind of advice that I needed. And that's whenever I decided, okay, I'm going to go ahead and do this.
Excellent. And how far are we now? How long was it since you had your surgery?
So coming up to a year.
How do you feel?
It's definitely not an easy way out. A lot of people think, oh, I'll get the sleeve. It's really easy. And do you know what? It is mentally and physically hard. You know, you're restricted from what you can eat. So
in what way? What's your daily?
So basically, the surgery itself, basically 80% of your stomach is removed. That's how much of it, and you're left with just like a tube for a stomach. So for the first 2 weeks, you're on fluids only. Okay, so trying to hit your protein goals isn't great in your first couple of weeks. It's so hard because you're so restricted. After that, you go on to a puree stage, then a soft stage, and then on to a normal stage. So there's a good 6 or 8 weeks where you're having to completely change the way you've been eating and drinking. So you're prioritising your protein to make sure that you're getting that and you're not suffering from muscle wastage or fatigue. You're prioritising your vitamins, which were the hardest to get down. You know, when you're on an empty stomach, you feel a bit sick. So it's like, it's tough going mentally and physically. And then when you are able to eat, it's making the right choices. Like for the first 6 months, which I actually found was the easiest part of it. I was prioritising protein, maybe being able to eat 2 spoonfuls of chicken and having to supplement that with a protein shake later on in the day in order to hit 80 grams. So like for talk's sake, if I were to have, like yesterday, and I'm nearly a year out, I made lamb for dinner. So I had a lamb roast dinner. And I probably ate about a quarter off a small plate.
Mm-hmm. But you've got to remember, you haven't got the capacity in your stomach anymore.
No, I don't have that capacity anymore. The reason why I've never spoken about it in this kind of capacity up until now is because as a medical professional, I didn't think it was right of me to go on and endorse something until I had lived it.
Yeah.
I see so many girls going on and going, oh, come and have a gastric sleeve with me. And 3 weeks later, they're on TikTok live eating chicken nuggets, you know. They're drinking fizzy juice. This is all stuff that you shouldn't be doing. I followed the medical advice to a T. Question things as well, you know, but as long as I had the rationale there to say, right, okay, this is what I should be doing. You have to be ready for it mentally and physically, which I don't think a lot of people are. You need to kind of ensure you're in the right frame of mind to be doing it. It's not a quick fix. It's not an easy fix. I know people who have had it a few years back and are almost back to their original size. So again, like the weight loss pens, it's a tool. It's not a quick fix, it's a tool.
Lovely. And if people want to reach out to you on social media, are you happy to ask their questions?
Absolutely.
Thank
Happy
you.
to answer questions and advise in any way that I can.
That's lovely, because I know in my clinic I'm getting a lot of questions about surgery and in different locations as well. So this is great. I'll be signposting them to your direction.
Oh, do you not find people nowadays talk about the likes of toxin and fillers, like they're getting their nails or their hair done? It's that common, but surgery's getting that way now too. People are looking at surgeries and talking about them as if it's nothing now. It's kind of scary.
I think research.
Absolutely, research. And if something sounds too good to be true, if there's no downtime, no what would the word be, side effects or anything like that, no, run a mile. Ask questions and do your research.
And side effects wise, were there many side effects post surgery? I mean, I know a lot of people are really interested to find out.
The restriction was the main thing, what you can tolerate. You have quite a lot of heartburn, acid reflux. There's a thing called dumping syndrome, that if you eat the wrong types of foods, like it's literally in your mouth a few minutes and it's out the other end quite quickly, which isn't very nice. And like, I can't eat cream, ice cream, anything like that. I'm lucky enough, as in I can eat most things now, but I know people who are still that restricted. There's a lot of things they can't have in their diet.
So pen wise, we're not on any pens anymore now.
No,
you don't need to be.
At all, no.
I also have done the weight loss pen as well. My journey was slightly different to yours. I lost 5.5 stone. I came out of lockdown 3.5 stone later, where everybody else came out of the lockdown 2 stone. But it was because I had time to walk. I had time to spend prepping food. You know, when you're really working busy schedules, it's quite hard. Yeah. Was it easy? No, definitely not. Did I have the side effects? Loads of them.
Did you? I was so lucky I didn't.
I had the nausea, the vomiting, the diarrhea. Where the majority of people are constipated, I didn't have that.
I had a bit of that.
And I had hair loss as well. That was a big one for me. So that was very early on in the sort of program. Then the research came back, a lot of work being done in America, and talked about your proteins then to maintain your muscle mass and to maintain your hair loss. So it's come on, even since I lost the weight 3 years ago, it's come on leaps and leaps and bounds. So I have taken that information and put it into our program as well in the clinic. And we have we've got nutritional support. Absolutely. We have got fitness support as well, which I think is really key, because you'll lose weight because you're not going to eat the same volume. But unless you go out and walk and hit them roads and walk, it's not going to come off that quick, you know. And I think that was really important. I got the mindset from a lot of patients that, jog once a week, weight will drop off. Yeah. That's not actually how it happens. No. You need to be walking at least 10,000 steps on top of what you would do normally. And I found the weight loss was better when I walked than when I didn't walk. Yeah. And I didn't do anything crazy in the gym. I mean, I'm 51, so I wasn't going to pumping iron and doing all them crazy things. Walking was my key. Now I'm doing more weight training because I want to maintain my muscle mass. Yeah. I'm that menopausal age. It's so important that I do more resistance training than actually doing cardio. Yeah. You know, and I've sustained my weight loss for nearly 2-3 years.
That's amazing.
So it is sustainable if you do it right, and it's not a quick fix.
And just what you touched on there too, we would have quite a few people come into clinic who are wanting to go onto these weight loss pens, but they've never went to a gym. They've never tried reducing their calories. I don't like using the word diet, because reducing calories should be enough rather than going on all these mad fads that people go on to. And we would actually turn them down for the pens until they have tried that first.
Yes.
Because I do think it's important to recognise that a healthy lifestyle and working out, whether that, like you say, just be a good brisk walk or going to the gym, is probably the most important way, because it's burning visceral fat as well. It's decreasing your risk of stroke, heart attack, type 2 diabetes. You know, it all goes hand in hand.
Yeah. So you say visceral fat. Explain to our listeners, because you and I know what that is.
Yeah, but sorry. All these terms. And I said I wasn't going to use any terms, but so basically with 2 types of fat. Subcut fat is basically the fat that's underneath the skin. And we then have visceral fat. So visceral fat's carried in and around the tummy, and it's in and around your organs, so it's not the best type of fat to be having. It's the one that can increase your risk of, like I said, stroke, heart attack, type 2 diabetes, and just, it's the one that we don't really want in there.
No, Absolutely, and it sticks.
Yeah, it sticks. Yeah.
Yeah. There's a lot of devices out there that can help with the visceral fat, but you know, weight loss is the first port of call.
Absolutely.
You know, the machines, they're good, but they're not surgery. I think that's really, really important. And I think also to have realistic expectations as well. Yeah. I know that we talked about, obviously, semaglutide, Wegovy. There's also Mounjaro on the market. Do you have much experience with Mounjaro?
I don't.
It's a GLP-1 and with a isn't it GIP as well?
That's right.
So it works on the enzymes in the stomach as well.
That's right.
Some of my colleagues have said that they've got really, really good results. They're talking that 25% weight loss is expected with it. I haven't really found that personally. I think each patient is very different. So I'm sort of moving between the two pens at the moment.
Well, to be honest, most of my patients are on the Wegovy still, because if it's not broke, don't fix it. They're having great results on that. So I don't see a need at the minute to be changing them over. If I had someone coming in fresh who wanted to try it, then yes, by all means. But at the minute, most of my patients are long-term patients, and they're happy enough on the Wegovy.
So the question we get asked a lot is, once you reach your targeted goal weight, do you stay on the pen or do you come off the pen, Tara? What do you advise your patients?
So when patients meet their target weight, I would usually recommend titrating it down and finding a maintenance dose that works for them. For the majority of people, that works really well. It's cost effective for them too, because it's less of a dose. And it also means that they're able to maintain and still be able to enjoy their foods and stuff again. Now, that wasn't in my case. So whenever I stopped taking the injection, because I had such fluctuations with my hormones, I had quite a fast weight gain again, which was what led into my surgery.
Mm-hmm. There is a lot of research papers out there that say you can stay on it on a maintenance dose indefinitely for the rest of your life, because obesity is a disease.
Yep.
And I think for people that have lost weight because of health issues, that may be the way to go. I personally got my goal weight and then went on a very low maintenance dose, worked alongside my practitioner and stayed on that for maybe about a year before I actually took myself off the pen. But what I would say is that it changes your relationship with food.
Absolutely.
And you have a much healthier lifestyle. The only thing as well, I mean, I had health issues. I was coming up with fatty liver. I had raised blood sugars, and I thought, I don't want to go this way. My blood pressure started to raise. So for me, my goal was health. And obviously my 50th birthday was approaching. So I wanted to be fabulous at 50 and not fat at 50. Yeah. So that's the way my program went myself.
Yeah, and another thing just that you said there, they say it takes 3 months to break a habit. So if you're breaking the habit of overeating, you're making new habits of walking more, drinking more water. You know, you should be in a better frame of mind and a better situation to be able to maintain your weight also. So yeah, it's changing your habits. You just have to remember it's a tool.
That's lovely. Thank you very much.
You're welcome.
Local Women Magazine presents Local Women Podcast, the show for things that matter. The Aesthetic Podcast from Local Women Magazine. This podcast is brought to you by BTL Aesthetics Ireland, supporting clinics with aesthetic solutions.